what do we do? Post-Polio Health International is one of, probably was the 5th or 6th name of the organization. We became a nonprofit in 1960. And mostly, I think the mission, maybe you re-say it at times, but the mission for the organization really has been to provide information to people with disabilities, to empower them to take control of their life and to live, as well as possible with the disabilities that they have, but also to then help change society, to make society more accepting for people with disabilities. Right now, when we describe our mission, we say that we have four areas of emphasis. So we educate, we network, we advocate, and then we also advocate for research to be done that would be important to people who are polio survivors and people who use home mechanical ventilation. And then we also have a small research grant that we give as well. But we also, as an organization, if there are issues that come up, we write letters, on behalf of our membership. If there's an issue with how they're going to fund ventilators, or they might change how they're going to fund ventilators, then we would write, we'd write letters on behalf of the organization. Every once in a while, in the United States, with our Social Security system or disability system, they want to rewrite the guidelines, and so when that happens, we're usually involved in sending them information and helping critique how they're written, and to make sure that polio people are properly included in those different, in the different programs. We do it a little bit, internationally. There's United Nations Convention on, human rights and for people with disabilities. Right. And then Post-Polio Health International has had international conferences since 1981, and so we are going to have our 10th. So it'll be Post-Polio Health International's 10th International Conference, and we are going to have it at Warm Springs. I think most of the sessions, we aim them for polio survivors and ventilator users themselves. We try to have the presentations by health professionals and a consumer, or somebody who has the problem themselves. So we try not to have a doctor standing up there just telling us how it is, but to have it more collaborative and a panel, so that there's that sort of interaction between, because we think that is one of the benefits of the conference, is to have health professionals interact with polio people. And that is, I think, one of the things that our organization does do, is to try to bridge that gap between the medical people over here and maybe consumers over here. So that's part of what we try to do. The first conference was 1981, and so I don't think that we don't necessarily feel the strong urge that we need to do post-polio, syndrome 101. I think that there's other sources of that, but instead of having this overview, one of the symptoms is pain. Okay, fine, so what are you going to do about pain? And here are some of the different options, or fatigue, and here are some of the different options.
So practical management techniques.
Right. More so than just, more so than just the academic. We just want to have a place for people to start, and we want to try to build up the people who are in other countries, so people in India can find somebody else, etc. Of course, there are a lot of disability organizations in those countries. Don't misunderstand. It's not that there's nothing going on, but if there's something specifically for polio, we would like to know about it. And even if it's in Missouri and we don't know, we'd certainly like to have them, have them in the directory, because that's where many people do start.
Susan Perlman, Sophia Chun, and Jacquelin Perry have all said virtually the same thing, which is the best way to get the information out there is to become self-educated and then take it up to the medical profession. Would you agree with that?
Yes. You have to go in as a informed consumer, and we put together a packet of information. It's probably more than a person needs at any one time, but they can pick and choose what's in there. And we advocate that they keep that. And if they're going in for major surgery and they're going to have anesthesia, take the 2 sheets of paper on anesthesia so that your doctor will know that there may be an issue. Doesn't necessarily mean that there isn't, but at least make them aware that you could pose some unique problems. So either positioning or if you have some pulmonary impairment, not enough to require any kind of artificial equipment or anything, but when you're sedated, you're not going to breathe so deep. So just let them aware of that, so they can monitor you.
Does the government recognise post-polio?
Yes, on several levels. It is now a recognized disability. We have what we call Social Security, and we have a program that's tied in with that called Medicare. And in the manual now is post-polio, and they have a defining criteria. Of course, you've had to have polio sometime. You have to have various other qualifying conditions, but you can get early retirement because your stamina or whatever is less. There's a lot of good that's not happened in the last couple of years, but over the last 10 or 15 years. At first it was a real struggle for people who were moderately disabled and still continued to work for years and years, but their stamina was getting less to convince somebody that they needed to retire. Even doctors would say, you should do that. And they'd say, I can't, I won't have any income. So we have a pretty good safety net, if you want to call it that, for people that need to slow down.
Okay.
And then there are other programs that are not specifically polio related, but people with more severe disabilities. Like in my state, California, we have several programs. One is called In-Home Supportive Services. And there's an income means test. You can't have too much money, but if your income is low enough and your condition is such that you need help, they will provide funding to hire somebody to come in the house, either just domestic services, help do the laundry, up to personal care. You're assessed every year on what your needs are. And it's people I work with mostly on a day-to-day basis are the ones with more severe disability, and they wouldn't be able to survive in their homes without it.